This is a head-to-toe assessment process. In a head-to-toe assessment process, you want to remember you have to first wash your hands, and you have to process, you have to listen, and you have to auscultate. First, when you enter the room, you want to ask the patient, introduce yourself, tell the patient who you are and why you are there. Good morning, Miss Barbara. How are you today? Good morning. My name is Matthew. I'm going to be your nurse for this evening. I'm going to do a complete head-to-toe assessment on you. When you introduce yourself to the patient and you wash your hands, during the interview process, you want to inspect the patient. You want to observe their physical appearance. You want to see if the patient is dressed. You want to see if they're anxious. You want to see if they're well groomed. You want to also ask them after the vital signs. The vitals include the temperature, the pulse, the respiration, and also the pain assessment. Pain assessment is very important. You want to see if the patient appears in pain. You want to see what the severity of the pain is. You want to ask them where activate the pain. You want to ask them their pain score. Sometimes you'll use a scale for 1%. You want to use to tell them what the pain score is. And another thing is the neuro. During the neuro assessment, you want to find out if the patient is alert and oriented. In order to find out if a patient is alert and oriented, you want to ask them for their name. You want to ask if they know the date and time of what it is. Like for today, you want to ask them, Miss Barbara, do you know what date is today? Or you also want to ask, do you remember what you ate for breakfast yesterday morning or for dinner? Or sometimes you want to ask, do you know who the President of the United States is? So, Miss Barbara, do you know where you are?
Yes, ma'am, I'm in the hospital.
Can you send me your full name?
Barbara Harris.
Do you know what date is today?
Yes, today is April 18, 2013.
Okay, Miss Barbara here appear alert and oriented. It's very important to see if they have, while she's speaking and telling me what the day and the time is, you want to also look at, listen to her speech. You want to hear if her speech is regular. You want to see if she's doing any stuttering. You want to see if she's putting her words out and she's pronouncing the word as they're supposed to. After that, you want to continue the neuro process by looking at her facial appearance. You want to look at her eyebrow, her eyelid, her eyes, her cheeks, the lips, the nose. You want to see if everything is symmetrical. You want to look at her ears. You want to look at her cheeks. You want to make sure everything is symmetrical, and then you're going to start palpating. You want to palpate for lymph nodes. You want to see if she has any swelling lymph nodes, some inflammation. You want to make sure everything is tight. You want to check for her carotid pulse. You want to make sure it's present. You want to ask the patient to open her mouth. Miss Barbara, can you open your mouth for me? If you have a tongue blade at this time of the assessment, you want to put it on her tongue to check for gag reflex. You want to make sure she has her own teeth in her mouth, or does she use denture? Because some patient uses denture. You want to check her gum for any bleeding, any inflammation. You want to make sure her gum is clean and it's intact. After that, you're going to move down to the body assessment. Now we're going to do the cardiac assessment. During the cardiac assessment, you want to look how Miss Barbara is breathing. You want to make sure her breathing is regular, that she doesn't appear anxious, that she's not breathing like she needs oxygen. After that, you want to do the cardiac process. You want to also listen for lung sound. You want to listen to her apical pulse. You want to see if she has good lung signs. So now, Miss Barbara, I'm going to listen to your lung signs, okay? Okay, doing a cardiac assessment, you want to make sure her heart is very important. You want to make sure it's her heart is, you want to ask her, Miss Barbara, have you have any trouble breathing lately? Have you have any, do you feel pain when you take a deep breath? Have you, do you have any fatigue when you, during the day when you exercise or at work? You want to ask her if she have any heart problem. Do you have any history? You want to ask question about history. If she have any problem of history that involve any cardiac issue. After the cardiac assessment, you want to move on to the respiratory process. The respiratory process is when you really want to listen to the lungs, you want to listen to the back. You want to make sure her lungs is clear, because sometimes you have patients that have asthma. You want to notice if she hasn't any wheezing. When you listen to the lungs, you want to listen to any abnormal lung sounds. You want to listen to like perforation rough or wheezing or anything. If she has any history of pneumonia. Miss Barbara, can you say that for me, please? You want to listen in the back for complete lung sound. Make sure her lung sound is clear. If you hear any abnormal lung sound, you want to document that and you put that to the physician. Miss Barbara, lung sound is clear. You want to listen in the front as well, which we already did. You can lay back there, Miss Barbara. After the respiratory assessment, you want to go to the genital system. You want to ask Miss Barbara, have you had any problem with urination lately? Have you had any problem with urine retention? Do you go to the bathroom regularly? You want to ask when she urinates, what is the color of her urine? Is it clear? Is it cloudy? You want to ask her if she have any burning on urination. You want to ask her if she have any problem going to the bathroom, because some patients can have urinary retention issue. You want to palpate a bladder, make sure it's not distended. Before you start the assessment process, you would like to ask the patient if they want to use the bathroom, because when you assess and you start to palpate, you don't want them to feel any pain. You want to palpate her bladder and ask her if she feels any pain while you palpate her bladder. She doesn't feel any pain, now palpate her bladder. Everything is good. Now you want to go to the gastrointestinal part of the assessment. Now, in the gastrointestinal part of the assessment, you want to first divide the abdomen into 4 quadrants. You want to listen to the 4 quadrants. You want to listen for presence of bowel signs. You want to know if it's active, hypoactive. You want to ask her when's the last time she has bowel movement. You want to know if she has any loose stool or any diarrhea over the past couple of days. If she moves her bowel regularly, most normal people about regular bowel movement is like 2 to 3 days. So now we're going to listen to her abdomen before we palpate. Miss Barbara has bowel sinus present, active. Now I'm going to palpate her abdomen to ask her if she feel any pain. Do you feel any pain, Miss Barbara, while I palpate your abdomen? Okay, she says she feels no pain. Sometimes you want to palpate over here because for your liver, the presence of your liver, you want to see if the person has any gallbladder issue. You want to see if they feel pain on their liver. So that includes the gastrointestinal part of the assessment. You want to go to the skin, which you want to check the skin. You want to check if she has any bruising. You want to check if she have any scab, if she have any surgical area like old scab, any healing wounds. You want to check if she has any lesion on her skin. You want to check her nails. This, you want to make sure that her fingers are even. You want to check for capillary fill. She has that present. She doesn't have any skin issues. You want to check her toes. You want to see if everything is symmetrical and the toes is intact. Now you want to go to the extremity. You want to see if her muscular system, if everything works. Because some patients who have a history of stroke or TIA, you want to see if they have any malfunction on one side. Some patients could be contracted. You want to make sure they can move all their body extremity well. Miss Barbara, can you move your arm up and down for me, please? Both arms. Can you put it up high, down, on your side? You want to ask her to move her legs. Can you put? She does that well with no pain. She has no. You also want to ask the patient to see if they have good bad mobility. You want to ask her to turn, reposition herself. They reposition herself independently. Because some patient might not be able to reposition herself independently if they have a problem with stroke. Ms. Barbara here reposition herself independently. You want to check the bottom. You want to assess if there's a guy. You want to check you want to check if you want to check their penis. You want to check you want to check if everything is intact, if it's clean, if it's a lady. You want to check that labia. You want to see if everything is symmetrical, if it has any lesion. Ms. Barbara, can you turn over for me? And that includes the head to toe assessment. Alrighty. Then we'll cover the part of vital sign, we'll cover the neuro, we'll cover the cardiac, respiratory,